Hi, I'm Dr. David with Well-Life Family Medicine, and we wanted to make this video today to bring you guys some tools in the face of COVID-19 coming. A lot of people are asking, a lot of patients are asking, what other things can I do to help my loved ones if they do come down with COVID-19. And so we put together this video today to show you some osteopathic techniques that were developed, and some of them as far back as 1918 in the Spanish flu, which claimed over 50 million lives. And these osteopathic techniques have been documented and passed down through the osteopathic schools, and are ones that we use to help improve respiratory issues, whether that be a pneumonia, whether that be bronchitis, COPD, asthma. All these things are indications for exercising the lungs, basically. And in a lot of ways, you kind of think of it as similar to stretching your legs before you run. These are ways to manipulate the body to improve respiratory function. One thing that we like to say is this is an adjunct to treatment, so this is not a replacement for medical treatment, but rather an adjunct to help improve symptoms, improve outcomes. There are some contraindications for these treatments. One being, and most of them are centered around the strength of the bones, and so osteoporosis is a potential contraindication for some of the techniques. If you have questions about how severe your osteoporosis is and how to modify the techniques, certainly our patients can get a hold of us at Well-Life Family Medicine. Another contraindication is if you have cancer that's moved to the bone, so bone metastasis, it could potentially weaken the bones and cause a rib fracture. So again, the purpose of these techniques is to try to improve respiratory function as best that we can. So adjunct treatment, we want to stress it's not a replacement of adequate medical care. We also want to make sure that all parties are safe, and the patient as well as the person administering the treatment. So make sure that you wear proper PPE if you're doing this on a patient that's had a COVID diagnosis or that's been quarantined for likely COVID. Protect yourself, and if at all possible, using a face shield and keeping distance. And we try to show you these techniques in such a way that would maximize or minimize, I should say, potential exposure to or aerosolation. But make sure if you have protective equipment to be using that protective equipment. So the first technique we're going to show you today is called rib raising. The purpose of the rib raising is to stretch the intercostal muscles. Now those are the muscles that are between the ribs, in particular areas that tend to be inhibiting of movement, which is the angle of the rib, is where we direct that treatment. And so you can see in the video that the patient is laying on her side, and I've draped her arm over mine. That way I can use my body to get a hold of the angle of the rib and pull each rib, stretching it up and towards the patient's head. And we focus our attention on each rib on both sides. So we only demonstrated the patient on the right side, but just realize that you can do this on both sides would be appropriate. The next technique that we're going to show you is a thoracic pump. This technique the purpose of this technique is to recruit more alveoli. And so the patient has to participate in this one. So you'll see the patient take deep breaths, and each breath that she takes, I'm resisting the motion, and each exhalation, I'm pushing in a little bit deeper. And so whenever she gets to her last breath and I feel like we've pushed in far enough, the patient will then be instructed to exhale and then suddenly inhale. And what that does, when she suddenly inhales, I release all my pressure. What that does is rapidly expand the chest, creating negative pressure in the thorax and causing the lungs to expand rapidly, potentially and hopefully recruiting more alveoli and opening up the lungs for expansion. So another version of the rib raising that we want to show you is patient laying on their back, and you slide your hands just lateral to the vertebra at the angle of the ribs. Now that's where we feel bony prominence of the rib, and that's before you get to the actual spine. And that area is the area that you want to provide anterior force. One way to do that without hurting your hands too much is to use your arms, your forearms as a fulcrum point. But you should be applying enough force to raise the patient's back off of the table by about an inch or so, and that takes a little bit of work. So the next technique that we want to show you is the pedal pump. This technique is for the purpose of lymphatic mobilization, which improves inflammation drainage. And so the technique is done by placing your hands on the soles of the patient's feet at the foot of the bed and simply pumping the feet with enough force that the patient moves all the way up to her torso. And so this one's pretty simple. There's not a whole lot to it, but it's quite effective at mobilizing the lymphatics.